KP, good morning. We apologize. We haven't had this in several weeks, but the Wi-Fi was having a little problem on the internet, so we went down and we reset everything thanks to Sam and Amanda over there. And if we can get Lisa or you guys to start blasting out, we're back live on Facebook and stuff like that. I appreciate it. So we're back. Dr. Whaley here is with me. How you doing, Dr. Whaley?
I'm doing great, thanks.
You wanna go right into questions?
No, I don't.
I didn't think you did.
Huh?
It's orange again.
You went orange again?
Go ahead, but it's orange.
You need to know about the tie. The tie is my prayer breakfast tie from yesterday. I think it's, if you watch what he said yesterday, he was much calmer, or more calm, which is right, more calm than he was the year before, trying to take pressure off the budget. And I am convinced that the budget pass in the middle of the night was because so many of the Republican spenders drink rum.
All right. And why would you think it's because the Republican spenders drink rum?
All right. You know that Fidel Castro, when he took over Cuba, what, in 1949? He expatriated the Bacardi family rum business, which was kind of like stealing the Coca-Cola. But the old grandfather left Cuba with the rum recipe stuck in his wallet. So the Cuban rum recipe left Cuba when Fidel Castro took over Cuba. And they began making rum in Puerto Rico and in the Virgin Islands called Havana Club rum. And they've been in the international courts for 30 years with Cuba fighting Bacardi over the name Havana rum. You still with me?
Yes.
Well, you notice that the spending bill had a extender for the tax cut for the horse racers, the NASCAR drivers, the movie producers, and the rum business. Now they had to give the tax breaks to the American rum business in Puerto Rico and the U.S. Virgin Islands to give them a level playing field. All in the rest of the world selling American Havana rum face to face against Cuban rum, which is supplemented by the government. So that's clearly why they spent that $200 to $300 billion on domestic spending, was because they were trying to protect the rum business. Do you think that might have something to do with it or no?
I don't know, but I could always count. I can always count on you to figure out another part of.
And I'm going to say another thing. You were saying, what did they lead with on television?
Yes.
The 8 o'clock lead, while you were sitting here fighting with the internet. All across there was, White House is known for many months about the sexual abuse. Not one single solitary thing about any of the memos or
nothing.
Nothing.
No.
I mean, to me, that's a non-story. But it was on for 12 minutes. I sat there and watched them, 12 minutes long. They were flagellating the White House, and they kept showing Kelly's picture and kept showing the picture of the president getting off the helicopter. 12 minutes worth of that on Morning Joe or whoever, Morning Joe, that the White House was complicit in covering up sexual abuse. Anyway.
The domestic violence, and it's like I said, I by no means do I want to have anything said. I want to take it serious, but it just seems like they find these opportune times to release information. It's not whether it's to be taken serious or not. It's just, it seems like these opportune times for them to release information about the time other things are going on, to take the lead away from,
I'll be darned.
Deflection. Deflection. Okay, the deflection.
Yeah.
Well, Dr. Whaley.
Let's go to questions.
Yes, let's go to question, because what's going to happen is is we can't take away from the all-star panel getting their point of view in.
Oil, not snow.
Exactly.
All right.
All right. Will a person with type 2 diabetes under control end up with the need for insulin?
You got that chart up there for the validated therapies for diabetes. I don't want everybody to try and read it, but the crucial part of that question, it's such a great question. I thought, my goodness, we could do hours on this, but the crucial piece of that question is under control. And the answer is, if it's under control, and the chances that you'll end up needing a change in therapy are not great, but they're not zero either. And the reason that I wanted to show that kind of a complicated chart there was that type 2 diabetes covers such a huge spectrum that the initial diagnosis, the height of the blood sugar, the height of the A1C, you've heard A1C before, all A1, blood sugar just tells you what your blood sugar is right this minute.
Right.
So if I eat a donut, it's going to be high. But the A1C actually is an average of what your blood sugar has been for 100 days. And it's that number that's most important, because when you walk in the doctor's office, if it's early in the morning, you've had nothing since supper the night before, it's going to be low. If it's immediately after a meal, it's going to be high. That blood sugar is not near as important. So anyway, if the A1C is high, then the initial management of the diabetes is probably going to include insulin. But if the person's overweight and can lose a substantial amount of weight, show that next slide there, the one that's got the weight loss thing on it. This shows how much a reduction in body weight might be expected to lower your blood sugar as the very first step in diabetic management. So as I've said here before many times, I always like to use the analogy of the three-legged stool. If you sit on a one-legged milking stool, you know platform, 2 legs, no platform, 3 legs, you can sit on it and it'll hold you up. So the three-legged stool of diabetic management before you begin taking any kind of medicine by mouth or insulin is weight reduction, that's what the chart shows you. Carbohydrate restriction, you just change your diet. And third, exercise, because exercise burns up blood sugar without requiring insulin. And so at the end of the day, I have seen many patients, and I just figured out last night, I hate to say it, this is my 55th year in medicine since I entered medical school. And I have seen legions, huge numbers of people who were diabetic, who either had a a gastric bypass or some other procedure and lost 200 pounds, and they were no longer diabetic, hypertensive, or anything else, or were modestly overweight and lost 20 pounds, 25 pounds, their blood sugar came to normal and it stayed normal. So that's a small group of type 2 diabetics. Their blood sugars weren't too high to start with. They're under good control. That group over time might end up having to take a pill. But those ones that have lost the weight, are on the diet, doing the exercise, and the question says under good control, can if they're properly managed, they get their A1C checked every 6 months by their doctor. And by the way, that's the official recommendation for checking an A1C in a diabetic if you're under good control every 6 months. If you're under bad control, it's every 3 months. 3 months, pretty close to 100 days, isn't it? So
right.
It tells you what happens to your blood sugar. Then you can probably stay off insulin. Go ahead. That's enough of that one.
Well, so when you go to your doctor and your doctor says, you know, and you do your levels when you do blood work, and the doctor says, you know, this is where you're at, but diet and exercise, you know, you need to listen to that.
That's the three-legged stool.
That's the three-legged stool.
Unfortunately, I hate to, I'm not going to make an indictment, but we have some family practitioners in this area who have a very high degree of interest, and I will say expertise in the management of type 2 diabetes, and they're taking an aggressive approach to it. But there is frequently, I see people who tell me, well, my blood sugar's a little bit high, and the doctor told me I needed to go on a diet. I'm going to do that later. I think one time, maybe a year or more ago, we talked about a very famous tavern owner in Atlanta who had a tavern with his name on it there on Highland Avenue, where all of the politicians in Atlanta used to have breakfast, the white politicians, or lunch. There was one place for the African Americans, and this was Manuel's Tavern. Remember Manuel's Tavern in Atlanta?
No, I really don't. But
oh, everybody knows Manuel's Tavern. Anyway, Manuel was a type 2 diabetic, and he became an advocate, but Manuel was a touch on the overweight side, and he ended up with diabetic-related blindness and bilateral leg amputations. And one of my partners treated him, and Manuel just he just couldn't follow instructions. And so you have to take the goal of therapy of the patient at the time of diagnosis, make them totally understand if your A1C is 8 or 8.5 and normal is 5 or 5.5 or 5.5, and you stay this way, you are going to go blind if you live long enough. Your kidneys are going to die if you live long enough. You're going to get numb in your feet if you live long enough. You're going to become impotent if you live long enough, and you might have an amputation. Now, that's what happens if you don't follow instructions. Do you want that or not? And then lean on them enough to get the A1C corrected. But anyway, back to the question. If they're under good control, no, they don't take insulin. So
that's an important subject. Is there a genetic factor to strokes? Is there a genetic factor to strokes?
Love this question because I could spend another hour on it. Put up that differential diagnosis of stroke there, because this is a bit of a definition issue. What is a stroke? That's a good question, right? What is a stroke? A stroke covers, you see that chart there has got about 15 or 20 lines on it. Every one of those lines, if you can read, you think people on TV can read the title?
Yes.
The title says acute stroke differential diagnosis. And there are 15 things there that all would present in the emergency room with what you would call a stroke. And they begin with a migraine. A premature migraine. Second would be some sort of a seizure, epileptic spell. Then there would be high blood pressure, hysteria, psychiatric disorder, infection, subdural hematoma, reaction to a medication or a drug. So all of those things that can be called a stroke, the answer to the question is no. Now, what's the sort of medical definition of a stroke? There are two kinds. One is when you have a thrombosis or an embolus to an artery that goes to the brain, think heart attack. And the second is when you have a hemorrhage in the brain. My father's stroke at age 73 was a bleed into the brain caused by an elevation in his blood pressure. He had high blood pressure, treated the way they treated it in the 70s, and his blood pressure, I'm confident, went up in the nighttime one night and he bled into his brain. So that type of a stroke, a hemorrhagic stroke, the result of high blood pressure, is certainly hereditary, because high blood pressure is hereditary. Most strokes are the blood vessel getting the flow cut down because you either have a clot in the blood vessel or you flip a clot from your heart, and that generally then is cholesterol, diabetes, which we just got through talking about, cigarette smoking, which was we've talked about before, but the diabetes, the hypertension, the obesity, the hypercholesterolemia, all of that is genetic. And so controlling those risk factors, if your grandfather died at 55 or 60 of a stroke and both of his brothers died at some time or other, less than 80 of something they called a stroke, and then you've got high blood pressure, your cholesterol's elevated or something, that is the congenital genetic linkage that causes stroke, and it's time to go lose weight and get the diabetes controlled and control the blood pressure. So the answer to the question is yes.
Our final question this morning, what exactly is a spinal block, a spine? What exactly is a spine block injection? Will it work long-term for low back pain due to disc problems?
You got that picture for me? Now, I know they can see that one. That's a pretty good picture there.
Is that it?
That's it right there.
I can't see it. Let me see it.
You want to look at it?
Yeah, because I...
All right. This is a picture of the lumbosacral spine at the sacrum, and it shows a needle going in two different approaches to reach the subdural space to perform an epidural steroid injection. I've had a number of those myself, none of which were long-term successful in relieving my back pain, but those are the type of injections that have the distinct possibility for a herniated disc that is swollen, of shrinking that disc down, and then hopefully, assuming that you don't have another something happen, can be long-term successful. Unfortunately, the marketing industry, and you watch TV ads about spinal injection, there are 15 different types of things that are not what that picture shows, that are not proven to work. Insurance generally doesn't pay for them, so they're expensive, and people are doing dozens of them every day. There's a clinic in Chattanooga, there's 4 of them in Atlanta, I think there's one in Gainesville. They have beautiful ads on television, and they are doing injections into the disc. That doesn't work, and it's got hazard. And they are doing other types of blocks that I would tell you are frowned upon by the established medical community and unlikely to be successful. So the answer to the question is the right kind of block can work long-term for a herniated disc, and it can't do a thing for what I've got, which is an old back. I was 5'11" and a quarter when I took a freshman physical in college for football, and I'm 5'9" and a quarter now. And that 3 inches is all pounded down in my back, and no amount of those spinal injections is going to help. So my back surgeon asked me one day, says, how many guys do you know that are 65 years old or older that used to be athletes that don't have a backache? And the answer is, I don't know any. So to answer the question, yes, the spinal injections can do well, particularly in a younger person with a herniated disc. And are they going to help an old guy like me? And the answer is no.
Dr. Whaley, I appreciate it. Those were 3 great questions this week. And obviously, we are very interested in, it's a serious question when we talk about diabetes, strokes, and lower back pain. And those are 3 major topics in America that are discussed all the time. We want to thank the Georgia Cancer Specialists for always supporting this segment and sponsoring this segment with Dr. Whaley. Ask the Doc. If you ever have a question for Dr. Whaley, you can send it to info, I-N-F-O, at Fetcher News. Put in the subject line, Ask the Doc. Let us know. We'll get it to Dr. Whaley. We did get a little long on the diabetes, stroke, and back pain, but I never want to leave without giving you an opportunity for a final comment, final thought, or...
All right, well, you started this morning with what are they covering? So here are 4 televisions where we talked about the White House knew about the sex abuse. That 4 televisions is on the Winter Olympics. And there is a real opportunity for disaster in the Winter Olympics beginning about 7 or 8 days ago.
It doesn't involve curling, right?
No.
All right, just check it, because that's the only disaster I'd be concerned about.
7 or 8 days ago, 41 security guards, all of them in one venue, came down with the norovirus.
Yes.
And you remember that's the cruise ship virus. They quickly isolated those people. thought that they perhaps had it under control. And having worked behind the scenes in the Olympics, I can tell you exactly what happened next was it entered the organizing committee. That's the people in Korea that have been working on this for a year and have devoted themselves to the Olympics. It hit them on Tuesday, and then yesterday showed up, and what's the worst people it could show up in? The cafeteria workers. So now it's in all three venues of the Olympics. No athletes had yet been struck because the athletes weren't there yet. Remember, opening ceremonies were yesterday or 36 hours ago, depending on what's over there. But the norovirus is in the cafeteria workers, the security guards, and the people that work there. And I'm of the opinion that you'll probably find it in some athletes who are going to compete, but they're probably going to end up taking IV fluids before they go, and their competition might be messed up by it. So I think that's something we should keep our eye on. The flu epidemic, I watch the obituaries every day. It's gotten worse since last week. And I noticed this morning, after I went to Atlanta yesterday to be with a family of a good friend of mine who died. But I noticed that I always watch what people die of, and in the Atlanta paper today, there's a very healthy 64-year-old athlete who died of the flu. And I mentioned last week the cheerleader and the basketball player who had died, and we're having a tremendous amount of people dying of the flu, and it's still not too late to go get your flu shot.
Thank you, Dr. Whaley. We appreciate Georgia Cancer Specialist. We're at Circuit World and Blue Ridge here, and I'm your host, BKP. We're going to take a brief break, and as soon as we return, we'll have our all-star panel with us. Again, thank you very much.